Okay, so when somebody has their teeth, their jawbone looks about like this. It's all preserved, it's being stimulated by the roots of the teeth that are present. When the teeth are extracted or lost due to periodontal disease and whatever, the bone begins to shrink away. Okay, it's not being stimulated anymore, and then on top of that, a lot of people are wearing a denture that's then suffocating the bone underneath it. One of the things we can do that's pretty neat in implant dentistry now is put an implant into the bone, and now we're stimulating it and there's no further bone loss. When you're missing a tooth, you have a few options on how to replace it. One is to do a bridge, which is the traditional way of doing it. Two would be something removable, which isn't very common because you have a big bulky device in your mouth just to hold one tooth in there. Another would be the dental implant. With the dental implant, it's a one-tooth solution to a one-tooth problem. When you're missing one tooth, a single implant's placed and a crown is cemented on just like any other crown on another tooth. With the bridge, you're actually having to cut down the two neighboring teeth in order to accept the bridge. Another thing I want to explain is when you lose a tooth, don't wait too long, because what's happening over time is the bone is shrinking away because it's not being used anymore. It's not being stimulated by the tooth root anymore. I also want to talk to you about mini dental implants. You're hearing a lot about mini dental implants, and mini dental implants can work, but there are limitations with it. If you think of the name mini, they are smaller, meaning you're building your foundation on a mini post, okay? So think about that, and the traditional implant is at least a 3mm or wider implant, a lot heftier implant. So not only are you getting support on the implant, you're also getting the retention, whereas a mini implant is primarily serving as retention only.